A very good morning to you all, and welcome to our celebration of Universal Health Day on this, the 12th of December, 2022. My name is James Fitzgerald. I'm the Director of the Department of Health Systems and Services here at the Pan American Health Organization, and it's a real pleasure for us to have you all join us here this morning on this celebration. Universal Health Day is a day that is officially designated by the United Nations, marking the anniversary of a unanimous endorsement of universal health coverage, or what we refer to in the Americas as universal access to health and universal health coverage, shortened as universal health, following the adoption of a very important strategic resolution in 2014, guiding health systems transformation towards the achievement of universal health. This year's celebration comes really at a critical time when many countries around the region and indeed the world are really rebuilding from the impacts of the COVID-19 pandemic, while at the same time facing many other challenges. And for this reason, the overarching theme that has been selected globally for Universal Health Day 2022 is Build the World We Want, a Healthy Future for All. In addition today to having the pleasure of our director with us, Dr. Carissa Etienne, we have convened a distinguished panel of health leaders from the Americas to examine some of the critical challenges around this issue. I really want to acknowledge the presence of Dr. Carla Visotti, the Minister for Health of Argentina, Dr. Frank Antony, the Minister for Health Guyana, and Dr. Jaime Orrego, the Vice Minister for Public Health and Minister for Health Colombia. In addition, we have the pleasure of having Dr. Alberto Arenas, the Director of the Division of Social Development from ECLAC, also with us this morning. So before we begin, just some advice on how to effectively participate today. Please, connect to the channel that you wish to receive the translation. We have a simultaneous translation of 4 languages available this morning. So please feel free now to connect to those channels at the bottom of the screen. Also, we encourage you to put any questions you have in the chat. We will have a question and answer session following the panel of the ministers. So part of my duty as moderator will also to keep everyone on time during your remarks. So please, panelists, as when you see me pop up, that will mean that there's essentially 1 minute for your intervention, so that we will have that time and an opportunity for everyone to pose their questions towards the end of the session. So without further ado, I'd like to hand over to our director, Dr. Carissa Etienne, for opening remarks. Dr. Etienne?
Thank you, James, and a very good morning to you all. Let me welcome you to our annual celebration on Universal Health Day under a very important theme this year: Build the World We Want, a Healthy Future for All. Let me pay a special welcome to Ministers of Health from Argentina and Guyana. Hello, I'm Carla, and hi, I'm Frank, and also our Vice Minister from Colombia. I want to thank you for sharing this important celebration with us. I know that all our countries connected today throughout the region are working arduously to translate this theme for Universal Health Day 2022 into reality. So let me also thank each of you and every one of our participants today. Your presence demonstrates personal commitment to the achievement of universal access to health and universal health coverage in your countries. And it is absolutely necessary, this personal commitment. Our commemoration of Universal Health Day represents an opportunity for us to reflect on the main challenges and opportunities that the region of the Americas faces to introduce the transformation change necessary in health systems based on the foundational strategy of primary health care and underpinned by the values of equity, solidarity, and really most importantly, the right to health for all. This year's celebration comes at a critical time when countries around the world are rebuilding from the impact of the COVID-19 pandemic, while at the same time confronting many other crises, including natural disasters and conflict, and a wave of foregone care and unmet health needs generated by the disruption of essential health services over the past 3 years. Faced with this, our countries are moving with urgency to implement policies and strategies to buffer and to build social protection systems while expanding the capacity of health systems and services that respond in a timely manner to the health needs of the population now and into the future. PAHO has played a key role in supporting member states in responding to the COVID-19 pandemic in the region of the Americas. And we are working intensively with our countries now on building sustainable and long-term strategies for the post-pandemic period, with resiliency, inclusion, and equity as drivers for health systems transformation. Our window of opportunity for action, however, is small. We do not know when and where the next international public health emergency will hit. But we do know that we have an obligation to act now to strengthen preparedness and response capacity and to expand universal access and coverage for all. We must learn from what has passed. We must take note of the context of health and health systems prior to the pandemic and understand how that context impacted the capacity to respond during the pandemic. Before the COVID-19 pandemic, our region was making steady progress towards the achievement of universal access to health and universal health coverage. But systemic deficiencies and inequalities persisted, and gains were slow. For example, the SDG 3.8 target on service coverage was improving, as shown by the UHC Service Coverage Index, which increased from an average of 65 in 2000 to 77 in 2019, reaching the third highest average value across all WHO regions. Between 2000 and 2017, the Americas was the only WHO region that experienced reductions in the incidence of catastrophic and impoverishing health spending. But despite this progress, inequalities in service coverage persisted, and about a third of the population continued to face multiple barriers to access health services, a situation that was more prevalent among, of course, the most vulnerable populations throughout the region. While public spending slowly improved, it was still insufficient, and low priority was given to investments at the first level of care. This is relevant because prioritizing the first level of care is a necessary condition to improve resolving capacity and access to health services for people and communities. The deficit of human resources for health in the Americas was and remains unacceptably high. We estimate that we will need an additional 600,000 health professionals in the region of the Americas to be able to recover the lost public health gains and to retake the path to achieve the health-related SDGs by 2030, a significant feat. In summary, the COVID-19 pandemic has reversed progress that was made towards the achievement of universal access to health and universal health coverage over the past 20 years, exposing and exacerbating structural weaknesses of health systems and health inequalities. The response to the pandemic has been limited by the historical weakness of the region's health systems, which has been compounded by long prevailing structural inequity and social exclusion and lack of adequate financing. The challenges of segmentation and fragmentation of health systems, characterized by weak stewardship and governance mechanisms resulted in poor systems performance even before the pandemic. Simply maintaining the continuity of essential health services while responding to the pandemic was a gigantic challenge for countries. In December of 2021, nearly all countries in the region reported disruptions in service delivery, with 93% of 28 countries reporting disruption of at least one essential service. And during that time, disruptions were reported across all health service delivery platforms, with the first level of care and community-based care services among the most affected areas. The health crisis further revealed the dependence of Latin America and the Caribbean on imports of medicines and other health technologies from outside the region, the vulnerability of global supply chains in emergencies, and the high degree of heterogeneity in the Americas in terms of COVID-19 vaccine research, development, and production capacity. If we are to build the world that we want and ensure health for all, this region urgently needs to act to reverse the socioeconomic and health losses caused by the COVID-19 pandemic. They need to address the growing burden of foregone care and recover the lost public health gains. We are fully convinced that health sector reform with a view to achieving universal access to health and universal health coverage based on a primary healthcare approach constitutes the foundation for building resilient health systems. These systems have the capacity to prepare for and respond effectively to crises, to maintain core functions when a crisis hits, and reorganize and transform if conditions require it. In 2021, our countries adopted the strategy for building resilient health systems and post-COVID pandemic recovery to sustain and protect public health gains. This strategy is guiding our actions for the recovery of health systems and recuperation of lost public health gains. Critical lines of actions have been identified by our countries. They call for transforming health systems based on primary health care, strengthening leadership, stewardship, and governance through a renewed focus on the essential public health functions, strengthening capacities of health service delivery networks, and increasing and sustaining public financing in health and social protection. Our member states are seeking to leverage the power of digital health to accelerate transformation, working across sectors to ensure that everyone can benefit from digital technology platforms. In addition, countries have called for renewed efforts to increase research and innovation for vaccines, medicines, and other health technologies, strengthening regulatory systems and promoting greater region-wide integration and solidarity in these efforts. And we have heard their call. And through the regional platform for the production of medicines and vaccines, launched with our partners last year, we are supporting countries and projects to ensure that we have the necessary vaccines and medical products to respond to our health needs in pandemic times and beyond. This overall framework provides us with a path moving forward. Our approach was the first to be launched by any WHO regional office, and it constituted the foundation for the action plan on health and resilience that was adopted by our heads of state at the 9th Summit of the Americas in June of last year. At the summit, PAHO and the US government announced the launch of the Americas Health Corps as one of our strategic efforts to build the regional cadre of health workers, the cadre that we need to address public health needs and to be better prepared for future international public health emergencies. And so as we continue to mitigate the effects of COVID-19, we are already envisioning a post-COVID-19 development era where health systems and societies are more inclusive, equitable, and resilient. That vision must, however, be translated into coherent policy reform and action at the country level if the goals that we have set for ourselves in the 2030 Agenda for Sustainable Development are to be achieved. Ministers, colleagues, friends, this will be my last Universal Health Day as director of this great organization. But I am leaving this organization with real hope. I have seen what our countries can achieve when there is the will. I have witnessed the capacity of this organization to respond to our member states in times of the greatest public health emergency of our lifetime. And I know that we can act collectively in the interest of all peoples in the Americas to truly build a better world and Americas for all. One that is healthy and one where the right to health truly becomes a reality. Thank you so much.
Thank you very much, Dr. Etienne, for that very comprehensive analysis of what has happened in the past and where you see the future of health and health systems in the region of the Americas and some of the challenges that really are now being faced by our member states. That, I think, provides us with a very nice segue into our panel this morning, a panel of ministers and a vice minister to really look at the issues around the right to health, as mentioned by Dr. Etienne, and some of the real changes that are required to ensure health, well-being, and social protection within the context of the challenges that have been outlined. With that, I'd like to invite Dr. Carla Visotti, the Minister for Health for Argentina, for her intervention. Dr. Visotti.
Muy buenos días acá en Buenos Aires.
Good morning from Buenos Aires. I'm in Salta, which is a province to the north of our country, with the flag of native communities that when one speaks of universal health, one obviously includes and clearly as a challenge all the cultural diversities and peculiarities of the countries in our region. To thank James for the invitation and to greet the director and to tell her that it will be her last day as director and our last day of universal health, but surely we will find her working on universal health whenever it is on her to do so. So thank you so much for these 10 years, this huge effort for the pandemic and the pandemic response and the collaboration. So in this Universal Health Day, I would also like to greet the panel and the more than 300 people connected from all countries in the region, 322 people from all of our region. And surely the motto and the challenge for building the world that we want and a healthy future for all is an immense challenge which requires political commitment which transcends health authorities. It requires commitment not only of presidents, but all national cabinets and in federal countries as Argentina. It also requires commitment from 24 jurisdictions with their budgets and municipalities. And of course, also it requires, as we already knew, but it was confirmed by the pandemic, international cooperation and solidarity and strategic planning. So from that perspective, in Argentina, our constitution values the social protection system and the healthcare system as tools which facilitate access to health, and the right to health is acknowledged in our national constitution. And in terms of public health, the importance of a present state which ensures health for all inhabitants of our country, and that guarantee of access to health clearly not always is made a reality. And this, I believe, is the greatest challenge. And there to name the barriers and the strategies, especially that we should implement as decision makers in order to make the right to health care more accessible to quality health care, and for that access to be equitable. And when one speaks of equity, one says that every inhabitant of our country should receive what they need from government, the specificity of their needs, and the fragmentation of the healthcare system, and the segmentation, the difficulties in financing clearly impact on access inequalities. So from the perspective of what the director clearly expressed, the impact that the pandemic has had in our healthcare systems has been really important of our healthcare systems, and also it has had a social impact and of course economical, very important. Countries as Argentina, where the national government has prioritized at the center of the political agenda healthcare with a budget for investment, and of course with teams who have managed in the full national government, and all line ministries in the national government have gotten to work on the pandemic. They have received social support not only from the public sector and the most vulnerable population, but also it has received support from the private sector, and of course, it has been strengthened and turned into a threat and opportunity is to strengthen the healthcare system, which has been able to provide a response to the pandemic. And as most of the countries in our region, and we're speaking about different domains, has had an unequal access to vaccines in the beginning, but later we have been able to access the vaccines. And in spite of difficulties, also with the highest indices of inequality in the world. So in spite of difficulties in access to critical supplies, we have been able to work along that line, providing a response to the pandemic, and our healthcare system has been spread thin by the pandemic, but now we're in a different stage thanks to vaccines. So that attention is sustained by the increase of the pathology with delayed attention of late diagnosis and chronic diseases that were not controlled, and the risk for having immunopreventable disease outbreaks, and the impact that the pandemic has had on mental health and mental health ailments. So thinking about access to universal health includes all of these aspects, which before the pandemic already generated concern for us, but it has much accelerated in this new stage of the pandemic, where our countries are beginning to suffer a new increase in the number of cases, and we are increasing demand for vaccines as well. So it is providing a response to all and each of these challenges. Thinking about the pillars to be able to access universal health are in sum the three that the director mentioned, which is primary attention, the integration of the healthcare system, and digital health. These are the information systems. At one point, the epidemiology and the laboratory were not walking hand in hand, and now nobody thinks about addressing a response without epidemiology and laboratory. Well, we need to add clearly to that double, to that duplicity, turn it into a triad in order to access comprehensive health and telehealth, digital health, epidemiologic surveillance, responding agencies, and from that perspective, the pandemic has also strengthened and made visible the importance of information systems in that sense.
De la pandemia y la necesidad de un abordaje
The impact of the pandemic and the need of a special tackling not only a population with special needs or native communities, but also those populations which have been most impacted in women, informal workers, the elderly, the youths and adolescents, sexual diversities, are populations that require particular contact to achieve concrete access to the right to health. And from what integration of healthcare system entails in Argentina, we are working strongly in improving funding, which will bring about surely greater efficiency and greater equity in health through a ruling role of the state with regards to what access for very high cost medicine is, and to adhere to the integration of the healthcare system in order to work on having information at the national level, not only for all jurisdictions, but also regarding each of the subsectors of the healthcare system, and to name or appoint in relation to the relevance which transcends health, the importance of health and the environment, climate change, the impact that war has also as an access to, as a hindrance to access to universal health, and to, of course, closing by saying that what will lead us to have success is also international collaboration, solidarity. The pandemic also left us lessons learned as a region, and those lessons learned are those that we must apply to further strengthening primary care, diminishing fragmentation in the healthcare system, and to advance strongly in expanding access to universal health in all of our countries. Thank you so much.
Many thanks, Minister Visotti, for that overview, really highlighting some of the key challenges from primary health to integration to digital health, but all within a context where we're looking at reducing segmentation, fragmentation, and increasing access. Thank you very much for that intervention. Let me pass over now to Minister Frank Anthony, Minister for Health in Guyana. Minister Anthony, over to you.
Thank you very much, Dr. Fitzgerald, Dr. Etienne, colleagues on the panel, colleagues on this webinar. First of all, allow me to thank PAHO for the invitation to participate. I want to say that Guyana's constitution enshrines the right to health as a fundamental human right. And many countries globally, particularly in Latin America and the Caribbean, similarly recognize health as a human right. Guyana has signed on to several regional and international instruments supporting strengthening of primary health care and the need for universal coverage. We agree with the principle that all people must be able to access health services they need when and where they need them without any financial hardships. Currently, millions are without healthcare access, and many more cannot afford care. These disparities are further compounded by COVID-19, which has disrupted many traditional public health programs, such as childhood immunization, HIV, TB, and others. COVID-19 has jeopardized many countries in the region from achieving some of the globally agreed targets, for example, to end AIDS as a public health concern by 2030. The current resource allocation and distribution structure has led to structural inequities in healthcare provision across the region. For countries to reach the goals of universal health coverage by 2030, emphasis must be placed on reducing these disparities. In Guyana, we have committed to our citizens to provide free healthcare services in the public sector. The public healthcare system has a network of health posts, health centers, district, regional, and referral hospitals across the country. With the assistance of PAHO, the Ministry of Health has mapped out services that would be offered at each level of the primary healthcare system. Work is ongoing to ensure that each facility can deliver on this mandate. This ongoing work revolves around several pillars, which include infrastructure upgrades, expanding our healthcare workforce, better access to medicine, and using digital health to improve care. On the infrastructure side, over the last 2 years, Guyana has made significant investments in public healthcare, in the public healthcare system. This includes upgrading all health posts and health centers across the country. And right now we are building 6 regional hospitals, which would ensure equity of access. In the compound of rural hospitals, we have added waiting homes where pregnant women can come to these facilities and wait until they're ready to deliver. This would reduce maternal mortality across the country. We are also building a new maternal and pediatric referral hospital, which is currently under construction. Next year, we intend to add more health infrastructure, especially in the interior of Guyana, to ensure that every citizen of Guyana can have quality healthcare access. On the human resource side, while we desire that Guyanese, every Guyanese to be able to see doctors and nurses, no matter where they live and no matter their socioeconomic status, our biggest challenge is losing many of our trained doctors, nurses, and allied health staff. We note that a similar trend occurs across the region. We welcome the US government America Health Corp's initiative, and we also welcome PAHO's leadership in this process. We also want to thank the WHO for catalyzing the process, this initiative, with a $2 million US. We hope that this initiative will address some of the human resource challenges in the region. Here in Guyana, we have adopted some new strategies, including hybrid training programs, decentralizing training, and we hope by doing this, we'll be able to train people closer to where we need them. We are also working on better retention strategies, and we are hopeful that this would slow the migration of our trained workforce. In terms of access to medicine, Guyana has increased access to free medicines in all our public health facilities. Currently, the Ministry of Health is responsible for quantifying, procuring, storing, and distributing medicines. At the same time, while we have improved availability of medicines, we are working to improve distribution, the distribution efficiency, so that the most remote part of Guyana would be able to have medicines on time. Over the next year, we'll be working to improve the procurement and distribution system. In terms of digital health, in one of the things that we have been doing is expanding digital health. Just recently, we have launched a pilot rural telemedicine clinic in 4 indigenous communities in Guyana. For the first time, these communities would be able to access ultrasound, ECG, and a number of other procedures using telemedicine. We will further expand this program in 2023. We have also introduced teleradiology, where many of our hospitals are now connected to the referral hospital in Georgetown, so that we can interpret CT scans and also digital X-rays. We are also working on a digital ophthalmology program, where many of our hospitals can now do ophthalmology for diabetic patients, so that we can scan their retina to see the conditions of their retina. And this interpretation is also done at our referral hospital. In 2023, we are going to introduce a new program for telepathology, whereby we'll be able to do the slides, take a high resolution image of those slides, and send them for interpretation by pathologists. This would increase the turnaround time or decrease the turnaround time, because currently to read a slide, it takes about 3 months. and we'll be able to do this within 5 days. So over the last 2 years, with our focus on improving healthcare infrastructure, increasing healthcare staffing, using telemedicine, improving access to medicines, point-of-care testing, we have seen a transformation in our primary healthcare services for all our patients. And this is how Guyana is building equity in the public health sector and giving new meaning to the right to health. So on this day that we celebrate universal adult coverage, this is how we are working on it here in Guyana. Thank you so much.
Thank you very much, Minister Anthony, for really laying out for us how Guyana is really approaching this from a very comprehensive perspective and really expanding the health system while at the same time noting the important challenges that you have mentioned in terms of human resources. And I think we'll come back to that issue also. I see a question already in the Q&A on health workforce, and we'll come back to that during the question and answer session. But before we do that, I'm pleased to invite the Vice Minister for Health, Dr. Jaime Orrego, Vice Minister for Public Health from the Ministry of Health in Colombia. Dr. Orrego, over to you for some opening remarks.
Good morning to you all, particularly special greetings to Carissa Etienne and Dr. James Fitzgerald from PAHO and our colleagues from Argentina and other high officials from other countries in the Americas. Thank you very much for this invitation on this day that we are celebrating universal health. On behalf of the government and Gustavo Petro, our president in Colombia, we want to say that we have the purpose to progress and retake process to transform systems that should be public, universal, and for free, guaranteeing access and not only coverage. In a day like today, we think it is relevant that coverage is not the same thing as access, and that both conditions are absolutely necessary to guarantee fundamental rights to health of all of our citizens in the Americas. In that direction, Colombia is working in restarting primary care in a territorial way. It should also be intercultural and participatory in all of the national territory, hand in hand with strengthening integrated healthcare networks where the public sector must guarantee its permanence and presence. This is a teaching from the pandemic, as well as the quality and sustainability all over the country, hand in hand with a private sector that is relevant and necessary, but articulated in territorial integrated networks. These two elements need strengthening of human talent policies to guarantee decent work to all the human talent in health. Mostly, they are mostly women, and also at all levels and all professions. There we see a big challenge, so that we have sufficient quantities, relevant professionals, and for equitable distribution of these professionals in the territory, so that our health staff with integrated networks can get into a universal approach to offer quality, timely, and relevant services so as to guarantee the fundamental right to health. This goes hand in hand with strongly progressing as a region and as a country in taking firm steps in the so-called health sovereignty, reindustrialization, and technological and scientific development of our capacities in the country and in the region concerning production of drugs, inputs, and technologies. and policies that can be applied to benefit sustainable access of all populations to the right drugs in the region. This has to go hand in hand with inspection, surveillance, and control in public health and, of course, governance. Remembering the lessons from the pandemic, our health authorities, their governance are fundamental aspects. Particular mention must be made to strengthening interculturality, gender approach, and all the differential approaches so that access to the fundamental right to health are done under conditions of equality and recognition of differences with no discrimination or advantages for privileged sectors. And if we have universality, we also have to have access, and that should not depend on their capacity to pay. Access to health is a common good, a public good, and should not depend on payment capacities. A different thing is financing. It has to be done through progressive taxes and quotations and other sources that show our collective will in the country, but not in the individual capacity, because it becomes an access barrier of concern. We need to harmonize universal access, and we need to do so. We need to link all public policies to all the adaptation and mitigation to climate change processes, because they are changing the living conditions of our territories, particularly where there is more inequality. This is our message. Thank you for supporting us, PAHO, and we invite all the countries in the region to take advantage of this kind of effort so as to guarantee our right to health. Thank you very much. Thank you very much, Dr. Orrego. Great thanks for your comments.
We have heard from three very different but distinct countries from across the region. Now we're going to move into a Q&A session. So I really would like to invite all the participants, the more than 350 connected. If you have any questions, we're going to have a question and answer session now with our panelists before we invite Dr. Alberto Arenas also to make an intervention on behalf of ECLAC. We already have a couple of questions, so perhaps I'd like to start with one question around from Diana Neira that really hits one of the key issues that I think also Dr. Etienne mentioned during her intervention. And it's around the principal strategy that really is functioning to support and address the gaps in terms of the lack of access to health in Latin America and the Caribbean. And so perhaps, Dr. Rizzotti, from your perspective, from the Argentinian perspective, what is the principal strategy that Argentina is really now promoting to build a better future, to address those gaps in access to health? This also within a context that we know, a complex fiscal context that we have now in the Americas. How do you see this? How do you see that principal strategy being implemented within that complex context? Dr. Rizzotti?
Sí, la verdad es que
yes, truly, it is a complex context in the region, and particularly in Argentina, with a very high inflation and a political situation that is complex. And this is why I was saying that it transcends health. We need to do progress in these objectives and these challenges so that health has to be a very high political priority. And many ministries have to be involved. Of course, the Ministry of Economy and the head of our cabinet. In the case of Argentina, housing, public works, environment, social development are ministries that work together to decrease that gap. And in that regard, the budget allocated to health has had no impact. On the contrary, we have seen an increase of gaps. And so we need to work on that. We are working on a primary care plan for health that includes technological innovation, and that also includes all the subsectors in the healthcare system. It's not only primary care and public health. We are working so that different subsectors also work on the primary care level and do not only finance demand. And thus, we have a proposal of financing for compliance of targets or payment per performance, and we are working on information systems, unifying them and strengthening them. These are the most important axes, and also in all the other health lines, mental health, chronic diseases, cancer, vaccination, we are working to decrease those gaps and also sectors.
Dr. Rizzotti. I'll come to Minister Antony in particular in a minute with regard to human resources, but I'd like to also ask that same question to Dr. Orrego, particularly within the context of the substantive and major health sector transformation now that is ongoing in Colombia. Dr. Orrego, from your perspective, from the Colombian perspective, whereby we understand that Colombia is really moving forward to increase access to health right across the country. What is the driving strategy that you are implementing to guide that major health sector transformation in Colombia at the moment?
Thank you very much. Yes, in fact, the first steps in these 3 months of government have been geared to retaking universal primary care through an offer that should reach all the territories in the country. 1,200 interdisciplinary teams with medical personnel, nursery, psychologists, etc., have been implemented. The target is to reach all the country's territories, and this implies at least 10,000 teams in 2023. This is articulated with the concept of restarting territorial integrated networks. There, the backbone is public hospitals together with private providers. These are urgent elements. We have to build infrastructure and progress on what we pointed as: one, increase healthcare personnel in its different professions; two, improve their resolution or solution competency, because they have been more devoted to specialization at the tip of the pyramid, and at the base, only administration. And this implies stimuli and incentives to redistribute our healthcare personnel in a more equitable way all over the territory, because as it happens in almost all Latin America, they are concentrated in large cities. And of course, under labor conditions that allow for permanent stability and the right to work. And the fourth element is very strong in terms of health sovereignty. This implies generating transparent rules of the game for the pharmaceutical industry, both international and domestic, and that the country restarts manufacturing hand in hand with science and technology in public-private alliances to generate its relative autonomy in connection to this. And we have the inspection, surveillance, and control, of course, and all of this, given our jurisprudence and our international commitments, shows that health should not depend on individual capacity of payment.
Grazie, Dr. Orrego. And I think we'll come back to that issue of leadership and governance and the overall contextualization of the National Health Authority and its role. But first, Minister Antony, we've heard from Argentina and Colombia, and you yourself also in your remarks talked about the importance of primary healthcare as the driving force to really build a healthy future for the Americas. But we also heard from you some of the challenges that you have, similar to, I think, what was mentioned by Dr. Orrego in Colombia around the health workforce. And in fact, we have a question that really talks to this issue, and whereby it's been mentioned around the issue of health professionals in the Americas, that we've lost a number due to, I suppose, people essentially leaving the profession. But there's also a key issue around access, availability, competency frameworks, professionals that really need to be working together in interprofessional teams. And we know that Guyana is facing a particular problem at the moment. So how are you envisaging this expansion of the health system within Guyana within a context in which you have this very complex scenario with regard to the health workforce?
Well, thank you very much for that question. I think it's quite a challenge for us because we are losing health professionals to other countries, especially developed countries. And what we have also is active recruitment from Guyana to go to these other countries. So one of the things that we have been working on is to expand our training. And as I said, one of the models that we are now looking at is to do hybrid training, where we can do theory online and do simulation centers where people can come in and have the practical component of that, their training being done. So this is something that we've been actively working on, and we're hopeful that by doing that, we'll be able to train more people and then employ them and be able to have them in different parts of the country where we need them. So training for us is very important, and retaining people as we go forward is going to be a very important component.
Okay, thanks very much for that. I understand. Thanks very much, Mr. Antony, for presenting that strategy. I think it's really going to be a challenge, not just for Guyana, but for all countries in the Americas in this regard. And we really see this need for strategic planning linked with the health policy component as we expand primary healthcare. I think that is going to be a major challenge for us all, and we certainly will be working with you on that. I would like to invite, we have actually Dr. Magali Gutierrez, the Minister for Health of Venezuela, connected. So I would like to invite the Minister for Health of Venezuela to take the floor. I am hoping that we have given her now access to the mic. Minister Gutierrez. If not, what I will do is I will come back to the minister, perhaps after the next question that's come in, and it really is around the issue of the issue that Dr. Etienne mentioned. Buenos días, ministra.
Buenos días, muchísimas gracias por esta.
Good morning. Thank you very much for this invitation in this virtual meeting on the day of global health. It is very important for us to participate here because we are nourished with these exchanges concerning health policies in all of the member states. That for our government particularly, it is an honor to attend to this invitation. As I said, it strengthens global health on forging the world we want, which is a healthy world for all of us. And we think this is a cross-cutting topic if we want to save humankind. We say that a healthier world is not only thinking on healthy diets and functional hospitals, it even goes beyond Ministry of Health. A healthy world needs to create social equity conditions so as to have a fair distribution of food, drugs, access to education, access to production, and timeliness in healthcare, access to technologies, and its service in favor of life. We cannot think in a healthy world if we don't think about the social conditions of the population who coexist in this world we want to transform. Seeing health as a particular and isolated element will make it difficult to generate mechanisms to protect health and will not allow us to reach our objectives, building a healthy world. This is not an exclusive agenda for those who take care of health. It has to do with all of our national policies in the world system. Our national government so understands, and this is why Nicolas Maduro Amoros, our president, is the maximum guarantor of our health in the country. Health is a central and cross-cutting issue in all of our governmental agenda. We invite you to reformulate categories, concepts, and tasks to achieve healthy lives and not only relate health to fighting diseases in health providing centers. It is impossible to think in a healthy world for all of us if we are not including the planet, ecosystems, niches, and all spaces where life develops. In the Venezuelan Republic, we will always be ready and moved for building the world we need. Healthy, fair, and equitable in all its social relations and all those that have to do with health. So thank you very much. I embrace you all.
Thanks, Minister Gutierrez. Many thanks indeed for those remarks, and indeed welcome to this celebration of Universal Health Day in 2022. It's really a pleasure to have you join us. Muchas gracias, Ministra. Es un placer de contar con su presentación.
Thank you so much, Minister. It's a pleasure having your introduction.
One of the issues that I think it's coming up, it has come up, that Dr. Etienne mentioned it as well, in terms of the dependency of the region in terms of vaccine, medicines, and health technologies, and how we can collectively act as a region to overcome this. And perhaps Argentina, given the capacity that Argentina has, Dr. Rizzotti, how do you see this in terms of a regional approach moving forward? What are the principal actions you think the region needs to take to increase manufacturing capacity throughout the whole of the Americas?
Gracias. Sin lugar a dudas,
Thank you. Undoubtedly, the most important goal is to be able to diagnose the situation on regional capacities, and based on that, to get working in order to become efficient, and not only with regards to resource utilization, but also with regards to outcomes. And of course, coming back, I will say it again, the maximum political decision. In that sense, PAHO is working quite strongly, and it is very important to our countries, both with CELAC as well as Marco South, in order to be able to synergize those networks and to approach projects and technical assistance to those places where there's also the possibility of the political decision. In that sense, in Argentina, the effort is always looking to the region by decision of the president. It's always thinking about how to favor access not only in our country, but in all of the region. The role of PAHO and WHO is in that same sense. Argentina and Brazil have been selected in the first point for technology transfer and production of messenger RNA vaccines, which has a very relevant importance beyond COVID-19 SARS-CoV-2 and inward. Argentina is working with the Science and Technology criteria with the Research and Development Agency in order to also be able to strengthen production nationally and publicly. For instance, on vaccines, there's an Argentine vaccine that's beginning phase 2 and 3 trials. It's a political decision to further in order to have development that is totally Argentinian with the research and the clinical research and the production and the research with regards to the vaccine against COVID-19, but also to strengthen our public production laboratories in the provinces and from the Lismol brand as a fundamental base, not only, and also this is very important, as a base for health sovereignty and access to supplies, but also for health to be a part of a country's economy, national production, substituting imports and scaling up production to be able to export makes it so that health supplies can also provide to the country's economy. And of course, if we synergize in all the region.
Many thanks, Dr. Visotti.
Gracias.
From the perspective of
Well,
a Caribbean country, a smaller Caribbean country, how do you see this developing? What would you like to see the region doing moving forward in this regard?
Did you address that to me?
Yes, I did.
Oh, sorry.
Yeah,
I didn't hear the beginning of the question.
Okay.
Yeah, I think one of the things that we need to do in the Caribbean is to develop a biomedical hub. We have some limited capacity to do manufacturing of pharmaceuticals in some countries, but I think there is an effort now for us to develop a biomedical hub. And that is something that a number of countries in the region has been talking about. So we are also, apart from doing pharmaceuticals, we're also interested in looking at development of vaccines. And we have been engaged with a number of the bigger countries in Latin America in those discussions. Also, we have been talking to countries outside of the region to see whether there will be synergies, especially in the manufacturing of mRNA, using the mRNA platform, not just for COVID-19 vaccines, but other technologies, because that's a very flexible platform as we understand it. We have also been engaged with a number of the companies that might have an interest in doing similar types of manufacturing. So I think there's lots of discussions, but over the next couple of years, we'll see how that materializes. Because if one thing COVID has taught us was that at the beginning, there were lots of challenges in accessing medicines and accessing vaccines. And we really need to build that capacity within Latin America.
Thank you very much, Mr. Anthony. And Dr. Rego, you mentioned in your remarks also that Colombia is really developing a strategy, a strategic focus around building capacity in science and technology with a view to addressing some of these issues. Can you give us a little bit more information about what that strategy looks like?
Gracias. En miras de la soberanía sanitaria.
Yes, thank you. With the goal of health sovereignty, we have begun the transformation of the health authority in Colombia and the Institute of Technologies. And we hope that in the first quarter of next year, we will have two entities that are totally robust, which ensure clear play rules, transparency, and efficiency in order to what it entails to study, to evaluate, and to issue health records in a condition of equality for nationally, internationally. The second step has been the development of instruments so that the national industry furthers production in generics, but also in technological resources. And third, We have furthered strongly the development of Bogota under a proposal on strategic alliance between the local government and the national government and the private corporations for the development of vaccines, which would combine biologists from the regular program in the country and also thinking about vaccines related to the pandemic. Fourth, the lines and terms of reference are being adjusted for the Ministry of Science and Technology so that they are more focused on the development of this kind of elements, factors that a country requires to develop healthcare. And finally, this is the opportunity to call to the whole region to develop institutional efforts regionally, which allow to provide more consistency and sustainability to pharmaceutical policy focused on public health and the guarantee to the right to public health and equality for all populations in America.
Thank you. Thank you very much, Dr. Orrego. This brings us to the conclusion, I think, of some of the discussions in the panel. It's really been an excellent panel, and I really want to thank Dr. Vizzotti, Dr. Anthony, and Dr. Orrego for their presentations and considerations around some of the big challenges that we've put here on the table this morning. I want to now invite Dr. Alberto Arenas, who's the director of the Division of Social Development at the Economic Commission for Latin America and the Caribbean, based in Santiago, Chile. Dr. Arenas, to give us a few remarks. Dr. Arenas, we've worked very closely with ECLAC during the pandemic around some of these critical issues that we've heard this morning. And really with a historic look back, as Dr. Etienne provided during her remarks, on the conditions of health systems, but also the important linkages required in terms of economy, the health and social protection. So Dr. Arenas, over to you for some remarks on this.
Muchas gracias, James.
Thank you so much, James, and good morning, everyone in Washington, D.C., and good afternoon for some in Latin America. It is a true pleasure to participate from CEPAL in this commemoration of the Universal Health Day promoted by PAHO especially, and the Dr. Etienne. A very special greeting goes out, and as she mentioned in her words as director of PAHO, and her last words as co-director, a very special acknowledgement, Dr. Etienne, for all the issues you have developed and led in such an important organization as PAHO. A very special salute goes out to Carlo Vizzotti, Minister of Healthcare in Argentina, Dr. Frank Anthony, Minister of Health Guyana, Dr. Jaime Orrego, Deputy Minister of Service Provision Colombia, Venezuela, Magali Gutierrez, and all the audience following us remotely. As James said, some closing words relating especially to advancements in social protection under what we have denominated at CEPAL. Unfortunately, we can say in almost 3 years of a pandemic with the social crisis that was prolonged. So social protection for sustainable development. Without social development, it is not possible to have sustainable social and economic development. After 3 years of a pandemic and in a situation of many crises in a cascade, there's an ongoing social crisis that remains relevant, and there's a situation with a deceleration of economic growth and informalization of formal employment, with a new wave of unemployment in a social situation with an increase of poverty, which deepens the ongoing social crisis. And this is how the right to healthcare has become under threat through a deep impact in the social crisis and social determinants of health. And that situation is fundamental to further towards social protection systems that are universal, comprehensive, sustainable, and resilient. Among other things that are related to social determinants of health, along with the strengthening of social determinants of health. And in that situation, we're convinced that structural reforms are required to guarantee the right to healthcare and to face inequalities in the region. And after almost 3 years of a pandemic, there is a situation of crisis, as mentioned in Cascade. Quickly in this graph, you can see the last 10 years, 2014 to 2023, there's a forecast of an average growth of 0.9%. And if one compares, for example, in the last decade in the 80s, which 2% is less than half. So there is a point where the engine of economic growth is weak in the region. And in that situation, the impacts to the pandemic, which persist, you can see in the graph the death rate by COVID, which has diminished since the beginning of 2022, but it remains deep inequalities in access to vaccines. 22 out of the 23 countries in the region are vaccinated at 70% of the total population with 2 doses. And there are many issues in health challenges with uncertainty with regards to the long COVID-19 as denominated. And there's an estimation of an increase of the main ailments in mental health worldwide, as has been declared by WHO. And closing with the issue of social crisis, this pandemic brought about a prolonged social crisis, almost 3 years, and this reflects in a deep the lashback in social indicators with regards to extreme poverty, which just deployed a regional program where we note an increase in 13% comparing to an increase in 11% in 2016. This represents a lashback of almost 10 years. And there's another issue that Latin America and the Caribbean suffered in the pandemic with the silent crisis in education, which precisely deepens inequality. There were 70 weeks on average where schools were closed in the region, comparing with the world, which had 41 weeks. Now, social determinants to health deterioration based on the pandemic reproduces and increases inequality, and in turn it threatens the right to health and universal health. And in that situation, poverty, food security, education, labor inclusion, and the very inequality generate conditions and weaken access and the right to health. And in that situation, we are proposing for social protection systems that they must be universal with regards to access to coverage. They must be comprehensive in terms of covering different demands from the population. It must be sustained in terms of its commitments in coverage and quality and universal attention. And they must be resilient in terms of the capacity to adapt for change and crises. And in that sense, the impact that the pandemic has had shows the need and the opportunity to transform health systems. Those transformation which guarantee universality, which overcome the current issue with segmentation, the 30-30-30 impact of PAHO, which strengthens the first level attention, focuses on the needs of people, families, and communities, removing in this manner the fragmentation of healthcare systems, which furthers integrality and articulation of healthcare systems with those of social protection, increasing public expenditure in healthcare. It's important to say that investment in healthcare should increase with the financial sustainability, reverting chronic subfunding in healthcare systems and strengthening resiliency of healthcare systems. And in that sense, investment in healthcare and social protection systems through primary healthcare attention is central to recover inequalities in healthcare and to further toward universal health. And in that situation, we think that it's fundamental to strengthen primary healthcare attention and health, since it is related to social protection systems and social determinants of healthcare and their actions and access to health universally. And in closing, universal healthcare at the sector of inclusive social development, we are convinced that defining health is key to attain inclusive social development. In that sense, the prolonged social crisis requires transformative and bold policies. And that situation is essential to generate new social impact, focus on right to equality, linked to tax impact, produce somehow that guarantees financial sustainability of social protection systems and financial sustainability of healthcare systems to advance toward a desirable state. We require comprehensive effort and taking charge of an uncertainty situation. And in order to guarantee healthcare, it is also required greater investment in healthcare, as mentioned, with financial sustainability, and that will require political agreement and social impacts. And in that sense, it is fundamental for the funding model is based on solidarity. And finally, there's an opportunity that unfortunately was left behind in the 3 years of the pandemic, which are structural reforms, which must further in and guaranteeing universal access to healthcare and social protection, and basically which tackles inequality in a situation and under the goal of building inclusive social protection and social sustainable development with equality. Thank you so much. Thank you so much, Alberto, for this excellent presentation.
For those remarks. It really shows I think, the overarching frameworks and strategic alignment between the policies of ECLAC and PAHO moving forward to move in the substantive reform of health systems, but obviously aligned with intersectoral action in countries. So colleagues, we have come to the end of our session this morning, but I really wanted to ask and invite Dr. Etienne to provide us with some final considerations, Dr. Etienne, some closing remarks from your perspective of what you've heard here this morning. And so over to you, Dr. Etienne.
Thank you. Thank you, James. Let me begin by thanking Carla Visotti and Frank Anthony, also Vice Minister Orrego, and our friend Alberto Arenas. I think it is true to say that PAHO collaborated with ECLAC, that the two of us collaborated to address many issues attendant in the pandemic. And I think together we have a good recommendations. We have made good recommendations to our countries, and I do hope that we can continue to work in this capacity. Also, let me thank all of the presenters for putting forward the various approaches and the various components of the resilient health system and transformation of health systems that they are doing at their country level. I just want to say that in PAHO, when we talk about universal health coverage, we are speaking about universal access and universal health coverage, both of them. And that is because our member states insisted that we put those together. And so we would normally talk about universal health in PAHO, but UHC is the term that has been used both in the UN and by WHO, but in the context of the Americas, it refers to universal access and universal health coverage as well. Now, in my opening remarks, I did say that I was living in hope because I do know what our countries can achieve because they do have the will. And I think what was demonstrated here today was the will to go forward, the will to ensure that people do have access and to healthcare that they need without impoverishment, and that we can reach the people who are most vulnerable. I heard the whole notion of ensuring that we reach people in remote situations, that we meet people, women and children who are living in vulnerable situations. We cannot talk about universal if we do not make a definite attempt to reach those who are vulnerable and those who now do not have access for various reasons. I heard all of the elements that we spoke about in terms of the lines of actions. I heard all of them being mentioned by our presenters. Important is the emphasis on equity, solidarity, and international collaboration, which was alluded to by all of our presenters. And I think that I hope that the Americas continue to build solidarity among themselves. We must not take it for granted. We came through a few years ago where that solidarity had crumbled and affected the ability of the Americas to come together as one and to move forward. we must guard this solidarity zealously, because it is only by working together that we can move this Americas forward, at least in achieving health and well-being for our peoples. Of course, the whole question of the social protection for health, access to social determinants and how this interplays with health, the fact that health is at the very center of development and that health must be invested in. Thank you, Arenas, for again revisiting these tenets and making sure that as we move forward another Universal Health Day, that we firmly recognize that it is not just access to health services, it goes far beyond this. It's access to social determinants, including access to safe and a work that pays people, but also all of the dimensions of the social determinants and the dimensions of health. I continue to think that government has a responsibility to ensure that happens. I'm not sure that government pays all of the money. That is my thinking that has been being transformed, I think, slowly, but I think it's government's responsibility to ensure that at least their vulnerable population have full access to health services, healthcare, and that they are integrally involved in its conceptualization. So, I mean, thank you so much. I think this was rich. All of the elements that we needed to hear came out. We saw all of what you are doing, and certainly my own congratulations to you for the work that you are doing. And Carla brought the whole question of federated countries and the need to work with the sub governments to ensure that they too are fired up and understand some of the basic elements that we need to ensure health for all. Thank you again. As I leave you, I am very encouraged that we are on the right path, and we need more and more to share what we are doing with each other. There is so much value in what each of you is doing in your own country. And James, this is my challenge to you, that you need to ensure that you have a forum, you have some way that across our region we can share all of those best practices, but also the lessons that will be learned, that on a regular basis that our ministers of health, but beyond that, our national authorities do understand that they don't really need to reinvent the wheel, but we can learn together and move forward. Thank you so very much as I leave you. God bless all of you.
Thank you very much, Dr. Etienne, for those words of wisdom. And yes, we'll certainly take up that challenge to ensure that countries have that forum moving forward. So colleagues, with those remarks from our director, we will close this event. Our thanks to you all, and a very happy and successful Universal Health Day 2022 to you all.
May I say good luck to Carla for the match tomorrow, World Cup?
And good luck, Carla.
Hope Argentina triumphs.
Very good.
And Merry Christmas, everybody. Happy holidays.
Gracias. Vamos las Américas.
Yeah, there we go.